Healthcare finances in Canada. The federal government contributes cash funding to the provinces and territories on a per capita basis through the Canada Health Transfer. The Canada Health Transfer provides long-term predictable funding for healthcare and supports the 5 principles of the Canada Health Act, which are universality, all insured residents are entitled to the same level of health care; comprehensiveness, all necessary health services, including hospitals, physicians, and surgical dentists, must be insured; portability, health coverage continues from a resident's home province during a minimum wait period when a resident moves to another province or territory; accessibility, all insured persons have reasonable access to healthcare facilities; and public administration, all administration of provincial health service must be carried out by a public authority on a non-profit basis. Provinces and territories must adhere to this criteria in order to receive funds from the Canada Health Transfer. Private health insurance plans are supplemental health plans to cover costs for services not covered under government plans, such as prescription meds, dental care, physiotherapy, ambulance services, and prescription eyeglasses. However, seniors, children, and low-income residents receive this supplemental coverage through their province or territory.